Hi, everybody. As promised, we are here this afternoon with Suzanne Sheridan at the Rockbridge Area Health Center. Thank you for joining us, Suzanne.
Thank you.
We are going to go over some of the quick facts and services that are offered by Rockbridge Area Health Center. Many of you know that they're an invaluable asset here in the community, so we thought we would catch up with Suzanne. And Suzanne, can you start by telling us who the Rockbridge Area Health Center serves?
Well, we serve anyone, and certainly we have a focus on low income and underinsured people, but our services are available to anyone in the community. And I think as we sit here today and think about what that means and who that would affect, I know that people are afraid. Some people have started to lose their jobs, so there's a lack of income. Perhaps there's a lack of insurance, and so one of the services that we provide is helping people during that period of time where maybe they need to transition to another health insurance option. Maybe it's Medicaid, and so we have people on staff that can provide some coaching and guidance through that process.
That's great. And that was leading right into my next question about people who are suddenly not working and find themselves without insurance. So I'm glad you touched on that for sure. What do you think? I mean, people are kind of worried about testing and whether or not they should be tested. What should people do in that circumstance?
Mm-hmm. So we're following both the Virginia Department of Health and the CDC guidelines. As if you've watched the news, you know that there's a lack of testing materials, and so for most people, the best thing you can do is, if you're experiencing symptoms, is to stay home and self-isolate, eat, rest, get plenty of fluids, and take that approach. Some people, I'll leave it at that.
Okay, yeah, that sounds good. And then if you have lost your health plan, you mentioned the Medicaid program. Is there a special enrollment period now?
There is. And so, depending on the person's situation, it's really, our folks are experts in helping people, guiding people through the process. So first thing is, don't panic, don't be afraid. I'm convinced that there's help out there for most people, and so worrying about your health insurance should not be one of the things that people worry about right now.
That's great advice. Definitely don't panic and just stay informed. And speaking of staying informed, what are some ways that people can contact or connect with the health center and those resources?
Mm-hmm. Just by calling our main line, which is 464-8700. There is now, I understand, there's a message right now just about the COVID-19 and directing people, but hang in there, listen to the public service message, and then take the appropriate options, which I don't have on the paper in front of me.
That's fine.
But 464-8700. And you'll receive help.
Great. Well, Suzanne, thank you so much for hitting those high points with us. The quick facts that we've been referring to is a PDF that we are at the Chamber will make available online. Yesterday, we launched our COVID or COVID-19 resource hub on our website, so we will make sure that this and other pertinent information gets updated and uploaded to that site.
Mm-hmm.
Meanwhile, again, if you have questions or if you've been impacted suddenly, feel free to reach out to the folks here.
Can I add one thing?
You can, absolutely.
Also, I know that, the Rockbridge Area Health Center, being an employer ourselves, I know many businesses and employers are concerned about their employees. So one other service we can offer, and this is off the top of my head, I'll need to be sure to communicate it when we're done, is for a business owner that's would like more information either for themselves and how we can help their employees, or if they would like to set up a conference call and we could put our counselor, our insurance counselors, just maybe a conference call with their employees, something like that. we'd be happy to do that too.
That is awesome. So definitely small business owners out there, take them up on it. They've got all of the resources and the tools here to help, and they are willing to do that. Well, thank you again, Suzanne. We really appreciate it. And everybody out there, take care.